Welcome back to the Deep Dive. Today we're getting into something really important, but often maybe not fully grasped. It's the caregiver's role during radiation therapy.
Yeah.
Looking at the sources, this one metaphor really stood out. Think of it less like a single appointment and more like a rally.
Yeah, like a long-distance endurance race.
Exactly. A journey, daily trips, weeks of it. It really tests everyone's stamina. So this deep dive, it's all about helping you, the caregiver, navigate that rally.
And what's really fascinating, especially coming from our source, Geriatric Oncologist, is the focus on the caregiver as, like, the rally navigator.
The crew chief. I like that.
Yeah, the one managing the whole human experience side of things. Especially for older adults, there are these two big hurdles that just, build up over time.
Okay, what are they?
Well, first, keeping their skin intact, it's often quite fragile. And second, dealing with this really deep cumulative fatigue.
Right, not just feeling a bit tired.
No, not at all. These can seriously affect whether someone can stick with the treatment, and their quality of life. Understanding why they happen is pretty crucial.
Absolutely. So our mission today, let's pull out the practical, proactive, like day-by-day stuff from this expert view. Real actions you can take for those specific side effects so your loved one gets through the rally successfully. We'll break it down. Prep, early weeks, the tough middle, and the finish.
Sounds like a plan.
Okay, part one, the pre-rally prep. That week or maybe two before treatment starts. This is where, honestly, I think the insights get really interesting.
Yeah, preparation is key.
It really is. Success in any endurance thing, it starts before the gun goes off, right?
Yeah.
You wouldn't just show up unprepared.
Definitely not.
Same idea here. We need to make that skin target area as healthy and tough as possible and kind of bank some energy.
Build that reserve.
Yeah. So skin prep, it actually starts from the inside out. The source really hits this point. Encourage good water intake.
Right. Simple but effective.
Because hydrated skin, it's just more pliable, more resilient. It's a better barrier.
Yeah.
Then, externally, start that proactive moisturizing.
Okay.
Get a good quality, fragrance-free cream. The source mentions things like Aquaphor, calendula creams, Myoderm, and start applying it twice a day at the area.
And that's not just about feeling nice, is it? That proactive step, it's about conditioning the skin.
Conditioning.
Making it supple, robust before the stress. And that fragrance-free part is critical. Things like Myoderm, they're often made without common irritants, parabens, lanolin, certain alcohols.
That can cause problems anyway.
Exactly, especially on skin that's about to be stressed. And for older adults, the oncologist points out, their skin barrier is often naturally a bit compromised anyway. So prehydrating is like a real strategic defense.
A strategic defense, I like that.
Yeah.
It's not just comfort, it's prepping the equipment. And, okay, don't forget the wardrobe. This gets missed.
Oh, yeah.
Pack away the tight stuff, the synthetics, anything scratchy. That friction, it's like tiny injuries waiting to happen on delicate skin.
Microtraumas, yeah.
So switch to soft, loose, natural fibers. Cotton, bamboo, silk. For breast cancer patients, maybe soft camisoles, no wires, or just loose tees. Anything to cut down friction.
Makes total sense. Less irritation from the get-go.
Okay, so the vehicle's getting prepped. Now, fuel for the driver energy banking, this radiation fatigue, it's not just, I need a nap tiredness.
No, it's biological, systemic, cumulative.
Yeah, the body's working overtime repairing healthy cells that get caught in the crossfire. So what can you do beforehand? Simplify the schedule.
Ruthlessly.
Seriously, cut out anything non-essential. Stock the pantry. Cook ahead, freeze meals. Get easy, nutritious snacks ready.
Because when that fatigue hits later, cooking is often the first thing to go.
For sure. And establish a rhythm. Gentle movement, like a 10-15-minute walk daily. And really focus on good sleep habits.
And just to build on that, our source explains that fatigue isn't just, physical depletion. It's the immune system basically working like crazy.
Like fighting something off constantly.
Almost, yeah. Repairing damage, clearing waste. Understanding that biological toll, it changes how you think about rest. So these prep steps, conditioning the skin, banking energy, they aren't just nice ideas.
They're foundational.
Absolutely. They're key to getting through the whole thing by building that resilience before the major stress hits. It's proactive.
Like the pit crew getting everything perfect before the race. Okay, prep done, loved ones ready. We're at the starting line, part 2. The first laps, weeks 1-2.
Right, the routine starts.
And like a good crew, getting meticulous habits down now prevents problems later. Side effects are usually mild here, but consistency is everything. So, skin watch. What might you see? Maybe feels like a mild sunburn.
Faint pinkness, maybe some warmth.
Yeah, tenderness. Our source also mentioned patients often feel a subtle tightness or itchiness even this early.
Ah, okay, an early sign.
Yeah, first sign the skin's getting fragile. So the daily routine, gentle cleansing, once a day, lukewarm water, fingertips.
Lukewarm, not hot.
Right. If you need soap, use something super mild, pH neutral, like Cetaphil or Dove for sensitive skin.
And that pH neutral thing, our oncologists stress that because regular soaps can be alkaline, right? They strip the skin's natural protective layer, the acid mantle.
Which you definitely don't want when it's already stressed.
Exactly. And after cleansing, pat, dry, gently, soft, clean towel.
Little rubbing.
Friction is the enemy here, seriously.
Moisturize, moisturize, moisturize. Get that recommended cream on generously 2-3 times a day.
But here's a really crucial timing thing.
Oh.
Do not apply it within 2 hours before the treatment session.
Ah, yes.
Yeah.
That 2-hour window. The oncologist called it a potential bolus effect.
The bolus effect, meaning what?
Meaning the cream on the surface could actually maybe interfere with the radiation dose getting to the target.
Oh, wow.
Yeah, it might reduce it or scatter it. So the timing affects the treatment's precision. Best times to apply are right after treatment and then again at bedtime.
Good to know. Crucial detail. And finally, sun protection is basically law.
Non-negotiable. That treated skin becomes incredibly sensitive to UV. Cover it completely. Dark, tightly woven clothes, wide-brimmed hat. Sunscreen usually isn't recommended right on the spot during treatment unless the team says okay.
Right, because ingredients could react.
Okay, so skincare is job one. But that fatigue is starting to creep in, even if it's subtle. Time for fatigue management. Pacing is everything now.
Even if they feel okay initially.
Especially then. Don't wait till they're exhausted. Use the 3 Ps. First, pace, short bursts of activity, then rest. A 10-minute walk is better than a 30-minute one that wipes them out.
Makes sense. Manage the energy tank.
Second, plan. Structure the day around the appointment. If you can, schedule a rest or a nap right after they get home.
Build it into the routine.
And third, prioritize what has to get done today. 1, maybe 2 things. Everything else, bonus, lean on your support network, friends, family for errands, meals, chores.
And this really shows how those small, consistent things in weeks 1 and 2 paying off, doesn't it?
Yeah, it's preventative maintenance.
Exactly. You're minimizing skin issues before they get bad, managing fatigue before it's overwhelming. It keeps the rally moving smoothly, avoids those early breakdowns.
Totally. Building resilience for the tougher part.
Yeah.
Which brings us to part 3, the mid-rally push, weeks 3 to 4.
Okay, the hard yards.
This is where, yeah, it gets tough. The cumulative effects really kick in. Our source calls this the most challenging phase, like that grueling middle stretch of the race.
Adrenaline's worn off, the road feels long.
Yeah, the wear and tear is showing. So, skin in the spotlight. Expect things to ramp up. That pinkness, it'll likely get bright red, maybe even look bronze or tanned.
Right.
Skin gets very dry. You might see flaking, peeling. That's called dry desquamation. And the itch can become intense.
Ugh, the itch. What helps?
Cool compresses. Soft washcloth, cool water, provides a lot of relief. Remind them, don't scratch.
Risk of infection if the skin breaks.
Big time. The doctor might prescribe a topical steroid cream for the inflammation and itch. But here's the big one caregivers most watch for. Moist desquamation. This is different, serious. It happens in skin folds, usually under the breast, armpit, groin. The skin actually breaks down, gets weepy, looks raw like a bad scrape. Painful.
And that's not a wait and see.
Absolutely not. That's a call the radiation nurse immediately situation. It needs special dressings, a specific plan from them. It's a red flag.
And that distinction is critical, isn't it, between dry and moist? Dry is manage the symptoms, moist is prevent serious trouble.
Exactly.
The oncologist emphasized ignoring moist desquamation could mean stopping treatment or getting a nasty infection. So the caregiver being vigilant, knowing when to raise the alarm, is huge. Your eyes are the first defense.
A total game changer for avoiding major setbacks. Okay, alongside the skin, there's the fatigue wall.
Ah, yes, when it really hits hard.
Often peaks around now. It feels overwhelming, just draining. And think about someone who maybe didn't do that early energy banking.
They'd be really struggling now.
Totally. Maybe can't even manage basic self-care. Huge strain. So focus on fuel. Appetite might tank, but the body needs calories and protein to heal.
Small, frequent, nutrient-dense.
Yes. Smoothies, protein shakes, eggs, yogurt, soups. Easier to get down than big meals. And validate the feeling.
That's important psychologically.
Hugely. Reassure them. This exhaustion is physical, it's the treatment, it's not weakness, it's not the cancer getting worse, and encourage active rest.
Sounds contradictory, but...
It helps. Doesn't mean exercise,
No.
just gentle engagement. Sit outside, gentle stretches in a chair, listen to music, conserve energy, but don't just completely shut down.
And the oncologist also pointed out it's vital for the caregiver to recognize this fatigue too.
Oh, for themselves.
Yeah, the emotional toll of seeing someone you love so exhausted, plus the physical demands of caregiving, it's immense. Managing your own expectations, getting support, prevents caregiver burnout. That's crucial for the whole rally team.
That's a really powerful point. It is a team effort. Okay, we're pushing through. Part 4, the final lap and cool down, week 5 and beyond.
Finish line in sight.
Almost. But this last week can feel the longest because side effects are peaking. And recovery, it goes way beyond the last session. Patience, continued vigilance.
Right, don't stop the care routines yet.
Definitely not. Skin recovery. The skin is actually most fragile during the final treatments and the first 2 weeks after the end.
Oh, after.
Yeah, the reaction often peaks 7-10 days post-treatment. So make it a bit worse before it gets better. Keep up that meticulous skincare.
Oh.
Long-term. Healing takes weeks, months.
Okay.
Redness fades, but the skin might stay darker, always more sensitive. And here's the forever part. Moisturizing that area. Permanent habit. Sun protection on that area.
Also permanent.
Lifelong. One bad sunburn there, even years down the line, can cause major problems. It's a permanent change for that patch of skin.
I get to manage expectations there.
And speaking of expectations, fatigue's long tail. Here's the big misconception. Fatigue does not just switch off when treatment ends.
No, it lingers. Weeks, months sometimes.
This is so important for patients and caregivers to get to avoid frustration. Why am I still so tired? It's normal. Manage those expectations.
It's like the body's engine has been completely rebuilt while still running the race. Everything needs time to recover system-wide.
Great analogy. So encourage a very slow, gradual return to activity. Celebrate tiny victories.
Making tea. Walk into the mailbox.
Exactly. Pushing too hard too soon just causes setbacks. It really is a marathon cool down.
And connecting that bigger picture, those long-term things, skin sensitivity, fatigue, they really underscore that the caregiver's role doesn't just stop at the finish line.
No, it transitions.
Yeah, from acute care to long-term protection, making sure that quality of life is maintained, still requires that attention to detail, just in a different way.
So you, the listener, you're the steady hand, the watchful eye, the navigator, the crew chief. Your consistency, your proactive care, it's invaluable throughout this whole rally. From prep, the daily grind, the tough middle, that long recovery tail. Your role is just indispensable.
And ultimately, what this deep dive shows, especially through that oncologist's lens, is how being proactive, gentle, consistent, it helps your loved one cross that finish line. Tired? Sure, but intact, ready for the real healing to start.
It's about that holistic support, physical and emotional.
Exactly.
So as we wrap up, here's something to chew on. How might these ideas, proactive navigation, really understanding side effects, apply to other long-term caregiving situations? What other kinds of rallies are people navigating in everyday health, and how can we be better crew chiefs for them?
Interesting thought.
Something to think about. We'll see you next time on The Deep Dive.